Let's talk about something called a gummy smile. You've probably seen it. It's just when someone's smile shows a bit more gum than they might like. For years, the fix was, well, pretty involved. But today, we are diving deep into a high-tech laser showdown that's completely flipping the script, and it reveals a pretty surprising truth about what really goes into creating that perfect smile.
And you know, this isn't just about looking good. It's way deeper than that. Research is really clear on this. Our smile has a huge impact on our self-confidence, even on how people see us. So fixing it isn't vanity. It's often about restoring that feeling of well-being. So here's the game plan for this explainer. First, we'll break down the problem. Then we'll look at the seriously cool laser solution. We'll compare two different techniques head-to-head, reveal the pretty shocking results of a big clinical study, and then finally we'll uncover what truly matters for the perfect outcome.
Okay, so what is really going on with a gummy smile? It might sound like a casual name, but there's a specific medical reason behind it. It's a condition called altered passive eruption, or AP for short. The best way to think about it is like this. Imagine your gums are like a window shade, and your tooth is the window. When the tooth fully comes in, that shade is supposed to pull all the way up to show the whole pane of glass. While with AP, the shade gets stuck partway down, keeping some of the tooth covered up. The good news is, modern dentistry has this incredible tool to fix the problem, a specialized laser that can sculpt things with just unbelievable precision. Say hello to the Cree laser. What makes it so special is its unique wavelength. It can perfectly and precisely remove both the soft gum tissue and, get this, the hard bone underneath. That level of precision means a whole lot less bleeding, way less inflammation, and honestly, a much smoother healing process for the patient. It's a real game changer. Now, here's where it gets interesting. Even with this amazing piece of tech, dentists have a choice to make. There are actually two main ways to do this procedure. The end goal is exactly the same, show more tooth. But how they get there? Totally different. So on one side, you have the open flap method. This is the more traditional way, where a tiny flap of gum is lifted so the surgeon can see and reshape the bone directly. Then you have the flapless technique, which is way less invasive. It actually works through the little space that's already there between the gum and the tooth. No big cuts and no stitches. Let's walk through the open flap method. So first, a small incision is made, and that little flap of gum is gently lifted. This gives a crystal clear view. From there, the laser comes in and precisely removes a tiny bit of bone. After that, the flap is just put back in place and secured with a few stitches. Now, compare that to the flapless method. It's so much more direct. First, the laser just trims the extra gum tissue. Then, and this is the brilliant part, the tip of the laser slips right into that natural pocket between the gum and the tooth to reshape the bone. No incisions needed. And to finish, the area is just cleaned up. No flaps, no stitches, you're done. Okay, so you have a more invasive way and a less invasive way. The big question is obvious, right? Which one is actually better? Does the simpler, easier, flapless method give you results that are just as good and just as stable as the old school approach? Well, that's precisely what a major scientific study decided to find out. And this wasn't just some casual look. The study was super rigorous. They took 36 healthy patients who all had APAC. They were randomly split into two groups, one for open flap, one for flapless. The procedure was done on each person's 6 upper front teeth. And this is the most important part. They were all monitored for 9 full months to see how everything healed and settled in for the long haul. And they didn't just check in at the end. Oh no. They took measurements at the very beginning, then right after surgery, and then again at 1 month, 3 months, and finally, the big assessment at 9 months. You need that long-term view to really know if the results are going to stick. All right, now for the good stuff. After all that precise work, all those measurements, and 9 months of waiting, what did the science actually say? Did the more involved open flap surgery prove to be more stable, or did the minimally invasive flapless technique actually hold its ground? Well, the answer is a little more interesting than a simple, this one's better. Because right at the beginning, during the first few weeks of healing, the two groups definitely looked different. At that 1-month check-in, the open flap group, which, went through a bit more trauma, had a little more inflammation. But the flapless group had its own little quirk. The gums showed more of what's called rebound, which means they tried to grow back toward where they started.
So basically, each method had its own little short-term downside. But hey, 1 month is just a snapshot in time. The really crucial piece of the puzzle is what everything looked like after 9 months, once the healing was totally complete and everything had settled down. And the final result was kind of shocking. Check this out. After 9 months, the tissue rebound for the open flap group was 0.25 millimeters. And for the flapless group, 0.26 millimeters. We're talking about a difference of 1/100th of a millimeter. That's nothing. It's statistically meaningless. The big takeaway here is that, in the long run, both methods gave the exact same stable, successful result. It was a tie. So this leads us to a really fascinating place. If the technique the surgeon uses doesn't really matter for the final outcome, does anything else? Well, the researchers dug a little deeper and they found one variable that made a massive difference. And the answer wasn't about the tool or the technique. It was actually found in the patient's own body. It all comes down to what's called your periodontal phenotype. That's just a fancy term for your own unique gum and bone anatomy. Some of us have a thick phenotype, meaning we have really dense, sturdy gum tissue. And others have a thin phenotype, with tissue that's more delicate and fine. And this turned out to be the absolute key. When the scientists resorted all their data by gum type instead of by surgery type, a super clear pattern just jumped out. People with thick gums had way more rebound, 0.32 millimeters on average. Compare that to people with thin gums who only had 0.19 millimeters of rebound. The message here is powerful. Your own biology is a much better predictor of the final result than the surgical method your doctor chooses. So what this whole study really tells us is that this laser tech has gotten so good, so predictable, that the choice between two very different techniques really only changes the first month of healing, not the final result. The real wild card in the equation is you, your own body. And that leaves us with a really cool question to think about. As our technology keeps getting better and better, making the how less and less important, is the future of cosmetic medicine going to be less about the procedure itself and more about tailoring it perfectly to our own unique biology?